Hi there, and welcome to A New Way to Age. My name is Terry Wheaton, and I'll be your host today. We are here with Dr. Walter of Medical Aesthetics, and on set right now are some of his patients who are doing the Bio Identical Hormone therapy treatment. So we're going to be talking to them. So first I'm going to speak with Gloria. Gloria,
Hi.
how are you today?
Good, thanks.
Good, I'm glad. So how did you learn about Bio Identical Hormone treatment, and what made you decide to do it?
I had read a lot of Suzanne Summers' books, which she had mentioned a lot about it.
Okay.
And so I had researched the bio-T or whatever, and a lot of the symptoms that they had, I felt like that I had.
Okay.
And most of it was the lack of energy and a hard time sleeping.
All right.
And so that's what I went and started having. And I looked to research the doctor the closest to me, and it happened to be Dr. Walker.
So it was Dr. Walter's office.
Right.
And did you decide to do it immediately after you spoke with him, or did you think, oh,
I
maybe
did it
should
immediately. I
wait?
went to him knowing that I was going to
You were going to do it. You were ready and
Right.
raring to go.
Right.
Okay. And so you mentioned that one of your symptoms that you really were dealing with was the sleep issue.
The sleep issue, right. And low of energy.
And low energy. So when you started, how long do you think you would say that you noticed a difference?
Oh, probably within the first month after I had them.
And it was measurable. Like you
Right.
could definitely say my
'Cause-
sleep improved.
Right.
My energy came back.
Yeah, and that's when I started walking because I was overweight.
Okay.
And before I didn't have the energy to even really exercise.
Really?
And so I started that. And probably by the time I went back for my second one, I was down like 20 pounds.
Oh, no kidding.
And so overall, I've lost 40 pounds.
That's wonderful. And you've kept, so how long have you been doing the
We were
pellets?
figuring that out earlier. It's
Couple years
2
back.
years.
Around 2 years
Yeah,
or so.
two and a half, something like that.
And you've been able to maintain that weight loss for
Right.
the entire time?
Yes.
Wonderful. Wow. So I'm sure you're telling all your friends about it, right? Because it
Right.
seems like it's a new you.
I do. And the first one was Stephanie, my daughter.
Okay.
And she says, Mom, I think that would help me out.
So Stephanie, so what made you, I know, obviously you
Right.
noticed that your mom was doing a lot better and feeling so great and losing weight. So that made you think, maybe I should look into
Well,
this.
when we started, she was sharing like, I think she shared a pamphlet that had like a lot of the symptoms and stuff that would help.
Yeah.
And I'm sort of pre-menopause, so I
Okay.
hadn't really, but I had started like, my body, when I go to sleep at night, my body like spikes in temperature, so I'm really like a furnace. So different things like that. My sleep, which I've always had great sleep, kind of shifted to where I was waking up for like 2 or 3 hours wide awake. I had like anxiety and slight depression even, which is so like not me
Stephanie.
from,
Right.
like I was super calm, chill person, and then I would wake up at night with like panic attacks almost. It was like, so I'm reading through these symptoms of some of the things that it could help, and I thought, wow, like I'm definitely within this range of time, and this might really be beneficial. So, so I went and I talked to him about it, and he was like, well, try it out. So,
Well, that's good that you're encouraging on it. That's great.
yeah, so I did, and it was awesome. So it everything shifted, and so my sleep. I now when I'm getting low, I start waking. I know that I'm actually
You can
low
feel it.
because
You
I can
can
feel it
tell
because my
that-
sleep starts.
It's time for another
Yeah.
hormone treatment.
Yeah.
And so how long did it take, would you say, for your conditions to improve, the sleep and
Probably the 4 or 5 weeks.
4 or 5 weeks?
I mean, once it started like kicking in.
Was there
That
anything else that it enhanced for you that you just didn't even think might happen?
I mean, just overall, like your energy, your health. I mean, it's really, yeah.
Yeah.
It just makes you feel better.
It makes you a new you, right?
Yeah. So, yeah.
The kids love it because she stopped yelling at them.
Oh, the kids. Well, that's good. The kids appreciate it too.
Yeah.
So this is your husband, Sean.
Yeah.
So you had told him about it. And so how long in between when did you decide to go? Like how many?
Well, it took him a month or so, because when I was in the office, it has the thing about the men, like the andropause and the different things, and I'm looking through this, and of course, he had kind of gone into a season where he was pretty grumpy, a lot of things that weren't necessarily who he's typically always been,
Sure.
So he was really kind of, and I was like, so I'm looking through it, and I'm like, gosh, I just think like this might be something that he needs. So I started telling him, and he was like, oh yeah, right. And so it was probably about 4 or 5 weeks, maybe more, where he would just kind of like, oh, yeah, right. And I was like, no, I'm really serious. And then he was a little bit like, well, did you make the appointment? I was like, no, I didn't make an appointment. Like, you acted like you don't want this.
Right.
So he did finally, he went in sort of reluctant, thinking I was a little bit like, all right, I'll do this if you want me to.
Even filling out the questionnaire, I'm like, she's like, you're more irritable than that. And I'm like, no, I'm not.
He's like going, no. And I'm like,
situation, you know?
Right.
I'm like, I would have put like, yes.
Right. So she was editing what you were writing.
Absolutely, and then I got irritated at her, so case in point. But then I received the treatment, and I really, at the time, I had really bad joint pains in my knees, and I thought I was on a cane for 6 months.
Really?
Really, if I went without it for even a half a day or a few hours, I couldn't walk the next day. I had to ice it. I said, wow, I'm going to have a knee replacement or something. Did a lot of masonry work, so I thought I just had worn the joint down. And,
Sure.
But I went on this thinking it was going to take care of the irritability and the lack of energy and motivation, which isn't me. I'm always on the go, getting it done. And so then after about 2-3 weeks after the treatment, my knee problems totally go away. And I'm hiking again and going to the gym and working out. So it was amazing. And, you know, I got the treatment not thinking it would, I don't even think Dr. Gert really thought it would affect the knees.
Sure.
When I told him it did, he was like, wow, that's like amazing. But all my joint pain went away and changed my life.
And it's still that in the same way. So you've been on it for what, a couple years now?
Yeah, and you know, when it gets low, I can start, you know, there'll be like a little pain, and I'll be like, I'm getting low.
Grumpy.
And irritability starts setting in, and
Right. And
We just went to Scotland this summer and climbed Ben Nevis, which is the largest mountain in the UK.
yeah, and no problems.
And
wow, that's amazing.
So, yeah.
You must feel like a new
It's dramatic.
human being.
It was a marked difference.
Right. So you have your wife to thank for, and your mother-in-law.
I do.
That's great. Now, we were talking a little bit earlier, kind of off camera, and you did have a funny little situation that happened when you first got the hormone treatment.
the first time,
And
unfortunately.
this is something that's just we're saying because it was a little bit funny, but not really. But it can happen.
I had a reaction, I think, to the anesthesia, and I thought it was the treatment, and so.
So you weren't too happy with your wife for suggesting it.
And I had to go on a business trip, and so my friend that picked me up is just like going, what happened to you? And so I said, yeah, my wife had me do this treatment thing, and look at me, I can't even walk. But
because your joints were swollen.
Everything was inflamed, and you know, I was on the water pills to try to reduce the inflammation, but you know, it ended up being that, and then after about a week, that kind of subsided, and then some of the benefits started kicking in, a lot of energy, and so I even considered it was worth.
But the funny part
doing.
is because you were mocking me for even suggesting you needed them, and then you went and got the treatment, and then had an allergic reaction to the lidocaine.
But it was the lidocaine; it had nothing to do with the hormones.
But he didn't know that the hormones were going to help him at the time. So within a week of the reaction, he's still in a lot of pain. He's swollen. He's even worse with his joints. And so then he's on the trip, and people are like, what happened? He's like, my wife had me do this treatment. And they're like, oh, you know, I can't believe this. Look what you've done to your husband. Why would you have him do this? And then a week later, all of a sudden, the effects started kicking in, and he was like, oh.
And the effects were so dramatic, I even said, you know, even if I had to have this reaction, I would go through that week to get the benefits.
So
they were so dramatic.
Quite a testament to the hormones that even if you had to go through that again, you would do it again because it just makes you feel so great.
Most definitely.
That's wonderful.
But they adjusted the anesthesia, and you know, now it's negligible.
So that's great. Yeah. Wonderful.
Best of both worlds now. I got it going.
So now getting back to you, Gloria, do you tell your girlfriends and people that you know that do they listen to you, or do you think that they have to see the difference in you?
Yeah. But, well, we have some people from church and stuff that actually have come, they're patients.
Oh, that's great.
But I tell anybody I work at Mattress Firm, and even some of my customers, they'll start asking, and so I share with them because they can't believe how old I am.
Right. I was not going to ask age, but clearly mother and daughter, but both benefit from this type of treatment. So that's a great thing, that it doesn't matter what your age is, that these hormones, once they're adjusted to the right level for you, can really make you feel like the best person that you possibly can be. I've also done the hormone treatments as well. I'm newer than you guys are to it, only a year now, but the memory was a big thing for me. So to have great memory back again, for me, was a big success. And that started within a month. And so you're right, you know, you really start, when you're low on something and your hormones get just tweaked to the right amount that it should be, you just are amazed at the results. And, you know, the word to get out is tough because, you know, people just don't understand. But when you have people like yourself that are real people and have gone through it, and as such a great testimonial for it, it really does help. And I think the basis of our show is we just want to get the word out to say, hey, you know, you don't have to age and feel terrible. You know, you can really feel like you did 20 years ago and have a great, wonderful life with it. So I want to thank all of you for coming today. I really enjoyed having you on set here and really appreciate it. Thanks a lot. We'll be right back with Dr. Walter of Medical Aesthetics to explain more.
So you see, son, good manners are important. Should I go through it again?
Yes.
Yes, please.
Yes, please.
Exactly. Always say please, thank you, you're welcome, excuse me, sit up straight, hold doors open for ladies. If the door's locked, knock first, don't burp, don't swear, don't stare, don't use bad language, or talk with your mouth full, keep your elbows off the table.
What table?
Don't interrupt. Cover your mouth when you cough or sneeze. On the bus, give your seat up to anybody who has trouble standing. Bottom line, treat others the way you want to be treated. Got it?
Got it.
Good talk.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Welcome back to the second part of the show today. I'm sitting here with Dr. Walter, Medical Director of Medical Aesthetics of New England. And we're going to continue on bioidentical hormone, the topic, but we're going to specifically talk about the function of the thyroid. Thyroid is one of those misunderstood glands, I think, in the body. I know a lot of women are concerned about whether some of the issues they're having is because of the thyroid. So if you could, Dr. Walter, just explain a little bit about the thyroid and how bioidentical hormones will help with the thyroid.
So when people come in to try to find out if they're low on hormones, we don't typically address the thyroid separately. We do that along with the testosterone, estrogen, progesterone, some of the other ones, because they really all will function together. Even though some people don't need thyroid and some do, and some don't need testosterone or estrogen, we go both by their lab tests as well as by their complaints. We kind of look at the patient, not just chase the numbers. Thyroid is very important because probably about 30 to 40% of Americans have low thyroid. And just even if they're within the normal range, if we can optimize it to get them to the upper end of the normal range, they'll often feel a lot better. And some of the common symptoms that people know about thyroid is if they feel cold all the time and if their hair's thinning and their eyebrows are thinning. But it's more nebulous things too. It's just kind of the brain fog, the not thinking clearly, the why did I leave my car keys? You know, it's the third time this week I've left my car keys. Or sometimes you just have less tolerance for other people, and it's just a little bit more anxiety. Those sometimes symptoms can be from low thyroid also. High thyroid, on the other hand, is sometimes you're too hot, sometimes you get palpitations and heart racing. So it's really Goldilocks. It's got to be sort of in the middle of the normal range. But a lot of patients where we do thyroid supplementation, they're actually within the range, but they're in the low end. And again, getting them to the high end will make them feel a lot better. And then especially if you add the other hormones, if they're low in that, it's kind of an overall package that makes people feel a lot better.
Okay, sure. So you said there's either high or low thyroid. So specifically if low thyroid, what would be the symptoms for low thyroid?
Again, most people are going to feel tired. They're going to just feel cold all the time. Like if everybody's dressed like me and then you're in a down jacket and you're inside, then that may be a consideration to watch for. And if the thyroid's really low, then you can start having the hair falling out. Typically, that doesn't happen so much from thyroid if it's within the normal range. But again, the thinning eyebrows, the thinning of the hair. A lot of things can do that, but low thyroid certainly can do that. And also, conversely, very, very high thyroid can make the hair brittle and easier to fall out too. So I'll go over the lab testing a little bit in a few minutes here, but it's something that we can check.
And the high thyroid, is there anything more to it other than the brittleness of the hair that are a symptom, maybe?
Again, palpitations, if you feel jittery, feel like you have too much caffeine.
Okay.
Those are the most common ones.
Okay. Does everybody need to be on supplementation for their thyroid when they do the Bio Identical Hormone treatment?
No, not at all. I mean, if your hormones are optimized, then there's no reason to add thyroid on.
Okay.
So that's what we look for. We look at both the symptoms and, again, looking at the blood testing.
Okay.
And if the blood testing shows that you could, especially if you're really low, but if you're even within the normal range but get you the higher end of the normal range, often that'll make you feel a lot better.
Okay. So conventional doctors, they test for certain thyroid normally, correct?
Yeah, it gets kind of complicated because this is a picture I pulled off the internet. So thyroid can be really very complicated. I'm not going to go over this because it's really difficult to understand. But historically, if you go to your regular doctor, your primary care doctor, they'll often do the TSH and sometimes they'll do the T4. And that's what they base their thyroid testing on. Historically, this is a picture that I use here. I kind of drew that myself, obviously, but to kind of make the thyroid more understandable, this is a picture of a body. This is the brain. That's a pituitary gland, makes TSH, that controls the thyroid gland, which is this little butterfly organ right here in the neck. And the thyroid gland makes T4, and T4 gets converted to T3. T3 goes into the cells and tells the cells what to do. Of all of these hormones here, T3 is really the most important one because that's the one that gets into the cells, hits the cell receptor, and tells the mitochondria to make more ATP. And most cells in the body have thyroid receptors because a lot of things in the body run on ATP. It's the little battery that's in the cells and tells the cells what to do. It gets enzymes working. It gets stuff in and out of the individual cells. So if this is low, even if it's in low normal, things are just going to function a little bit more sluggishly than they do if things are optimized in here. Historically, in the 60s is when thyroid testing first came to be, and the first test was T4, and they really had a lot of problems with that. It took a long time. They had to use radioactivity to test it. And then in the 70s and 80s, they started developing TSH. TSH, again, is a brain hormone controlling the thyroid gland. It doesn't really directly affect what's going on in here. There's a feedback loop in here, and again, I'm trying to make this not too complicated here, but TSH has become the standard, the de facto standard, because there's a lot of issues with doing testing to check for T4 and T3. And even more important is the free T3 and free T4. Because if this is your total, a lot of the thyroid hormone is stuck onto different proteins, and the free T3 is really very small, and that's the stuff that gets into the cells. So historically, very, very problematic to do these two tests here because you had to do it at body temperature, you had to make sure that the testing itself didn't have enzymes or other stuff in there that screwed up the test. So the third generation TSH kind of became the gold standard, and that's the reason for it, is that was more consistent. The problem with it is if you just look at the TSH, it doesn't tell you what's happening downstream. And even if your TSH and the T4 are fine, if you're not converting here, or as you get older, if your receptor isn't working very well, it's not receiving that free T3. Stuff can be happening at the cellular level or not happening at the cellular level where this all here looks fine. And this is kind of conventional testing, looking at these two things here. And again, I see people all the time with a normal TSH, a normal free T4, or a total T4, and a low T3. And that's really what needs to be treated, and that's what we do. Again, I'm trying to make a very complicated subject be a little bit simple here.
Sure.
But getting this to the high end of the normal range, again, the range is sort of 2.3 to 4.2, and getting up people around 3.8, 4, 4.2, something like that, often makes them feel a whole lot better.
Okay. And how do you do so? Is it in a pill form? Is it injection form?
Yeah, thyroid medication's a prescription. Again, if you go to your regular doctor and you tell them you're feeling sluggish and the TSH is high, which means that the T4 is low, typically they'll prescribe only T4. That's a synthetic hormone. It's Synthroid or levothyroxyl or there's other ones in that family. Synthroid is one. The problem with that is if they're gonna check the TSH and the T4 by giving you T4 and making sure that's okay. But if you're not converting to here, these two numbers could be fine and you still could be functionally hypothyroid. Really hard to measure is if the cell receptors don't work, and that often happens when people get older. There's not really a great test for that. So the conventional medicine checks the TSH and the T4, but again, the sort of integrative medicine doctors will also check those as well as the T3. There's yet another test that we check, and that's the TPO, or the thyroid peroxidase antibody. And what that is some people have something called Hashimoto's. It's an autoimmune disease where your antibodies are attacking your thyroid gland, and that can make the thyroid less efficient. It's not a horrible thing as far as being able to treat people, because people can have their thyroid gland completely removed, and we can treat them for their, replace their thyroid hormones.
Oh.
And Hashimoto's makes it less effective because it's plugging things up in there.
Okay.
So we just use that as a point of information and help us to figure out the treatment. Thyroid hormone is a prescription. T4, Synthroid, levothyroxyl, those are prescriptions that most people are probably familiar with. And we use something called Armour Thyroid or Nature Thyroid, and those are T4 plus T3 together,
Okay.
and those are bioidentical hormones, just like everything else we use here.
And they're not synthetic, they're
They're not
natural.
synthetic, right.
They're natural.
Yep.
Are there any side effects from taking thyroid medication?
Some people, if they're really sensitive to it, even if we get their T3 to the high end of the normal range, they sometimes can get palpitations, and we'd back off on it.
Oh, okay.
You usually have to go higher than that to have people feel like they're jittery or
Had too much caffeine or something.
Yeah,
Mhm.
and there's also people that will sometimes use thyroid hormone to lose weight. I think that's really a bad idea, because that's bringing their thyroid hormones too high, and it's almost like if you have a Ferrari and you're constantly redlining it and revving that engine. It's not good for the body to do that. It's not a good way to lose weight. There's much better ways to do that.
Okay. Well, I was wondering, when Carol was on, she said that she had lost 40 pounds. It could be a result of having her thyroid hormone put in check with the medication?
Yeah, with her, it was really not the bioidentical hormones, the testosterone, the estrogen, or the thyroid being used as a weight loss. She's really one of the exceptions, and I think what happened to her is she felt better. She liked going to the gym better. She recovered better. So she kind of incorporated that into her whole lifestyle, and I think she even said she changed her diet.
Okay.
But she's exercising more too. So it's not a diet pill.
Yes.
That's not how that was given. And most people don't lose that much weight.
It's
they will
funny.
exercise better. They'll have more. They get more tone, more muscle. But not losing 40 pounds is an exception in this.
Yeah, okay. Because I do hear my friends say, oh, I'm not losing weight, I'm stuck, it must be my thyroid. So even they have misconceptions about...
Well, it could be if their thyroid hormones are low. Again, the free T, if that's low, free T3, if that's low, then optimizing that can help them exercise better, and sometimes they'll lose weight from that. But weight gain is a lot of things. Again, at menopause, it's often estrogen, deficiency in estrogen, low testosterone, thyroid. It all fits together. That's why we look at all of them.
So, Dr. Walter, we're at the conclusion of this show, and I realize, obviously, that the thyroid is a difficult thing to discuss in a short period of time.
And complicated, sure.
So I'll just let everybody know that, feel free to give the office a call or visit the website, make an appointment with Dr. Walter. He can go over all the complications of the thyroid with you at that time. I want to thank the guests that were previously on, Gloria, Stephanie, and Sean. They were great. We had a great time with them. And I want to say a big thank you to ActonTV, and we'll see you next time.